then you will find that there is a regulation under the Ministry of Energy that addresses that issue. So that cross-cutting nature of OSH is an opportunity for us to harness occupational safety and health in the different sectors of the economy.
We should invite this police, because what we are discussing is completed. It may start small, but it end up into emergency.
Thank you so much. I had one question addressed to me, and it was around expounding on opportunities for knowledge sharing. I want to urge us to leverage on the presence of technology. And for us as SHAU, we do have a program, and we run a series of webinars on topical issues concerning occupational health and safety. And we collaborate, we bring in industry experts. We always have this information broadcast on our social media handles, and we call for the public. It's not always restricted to the members, but anyone who can access. We have that opportunity where a lot of information is shared and free of charge. All that you need is to ensure that you have stable internet connectivity for you to be able to take part in these opportunities. But I also know that some sectors, especially in the oil and gas sector, through the Industry Enhancement Center, they run a series of programs. And again, this information is out there. They advertise, they reach out to companies. And it's not only specific to occupational health and safety programs, but a series of programs. So I also want to interest those that are interested as individuals or even companies to look out for these opportunities, and you'll be able to partake in these training sessions.
My question is to Sarah regarding technologies. Now, one of the things we try to introduce, well, we have introduced, are electronic HSE observation cards, because we found that we were printing loads and loads of cards for the workers to fill in their safety observations. When we put that out to our contractors, they said to us, it's great having your QR codes and being able to fill the cards in. However, we still need paper. So currently we run both systems. We have the electronic version and we have the paper cards at our sites, but that's still generating quite a lot of paper and waste. So I'm just wondering, from yours, through your eyes, what do you think are some of the ways we can encourage more electronic use without isolating our casual workers?
My question was from Collins and Meko, especially in the comparison between big corporates, that is global workplaces, vis-a-vis the local workplaces or small local companies. There seems to be a big difference, especially when it comes to safety compliance between the two. And they were wondering why. You'll realize that most of these big corporates, they adopt global workplace best practices over and above what is within the regulations and statutes within our countries. And again, most of them are from regions that have been practicing safety for a long time. For instance, from UK, Australia, the US. So safety has really been built into their system, and they know that it comes at number one priority in their workplaces before any other thing else. When we come to our regional or local workplaces, there has been progressive development, especially when it comes to occupational safety and health. You'd realize that for a long time, this has been shouldered under the Department of Labor, and it is the HR officers who are also, by extension, responsible for the function of occupational safety and health. And because of lack of expertise, this has not been handled well. But we are seeing progressive development, especially we have OSHA 2006 in Uganda, OSHA 2007 in Kenya, and this has opened the space, and the vibrancy that has been created, of course, has given birth to the association like SHAU, and now we are seeing changes. Things are picking up.
My name is Brian Kwizera. I'm a member of SHAU, but I also work with Uganda Bat Limited as a quality inspector. And I have two short questions, and we'll go to Mr. Ogwal, Alex. From the presentation, in terms of about the roles of the department, he mentioned about workplace inspection. And I was wondering, in the same presentation I saw the framework in terms of human resource. Those numbers are not enough, according to me, for the entire country. So my question is, how have they managed to do the work, the inspections all over the country to make sure that people are doing the right thing? But the second question is about the law, and it will be the local legislation. In the 1995 Constitution, and to Article 39, I'll read it, guarantees every Ugandan a right to a clean and healthy environment. But we are in workplaces where we work with our colleagues not from Uganda. They come from, let's say, Kenya, Tanzania, but we work with them. Those are not Ugandans. So is this article selective? Is it general? All the other articles that address such people? You know, I want our friends from Kenya, the WASPAC and TOSA to be, don't get scared to work here. Thank you so much.
Whether you are Ugandan or a non-Ugandan, if you are in Uganda, you must observe the constitution of that land. So you cannot say, because this provision is talking about that Ugandans should observe this, and you are non-Ugandan and you are not going to observe it. Have you not seen people being taken to court when they are non-Ugandans? So this constitution is a universal document, a universal law that governs everybody who is in the land of Uganda. So even if you are brown, you are white, you are black, you are yellow, if you are here, you have to observe the constitution of the land. So my brother, that is it.
I'm representing Square from Nairobi, Kenya. Square is divided into 3 business verticals. Just briefly to highlight, advisory, capacity deployment, and digital toolkit, where we collect HSE and ESG data, and we help organizations to do data analysis on the same, and they can also do sustainability report from the digital toolkit. So I love the presentation that was done by Joseph. And my key takeaway from your presentation, you did say that employee well-being shouldn't be left to chance or to the responsibility of the employee, but we should have leadership representation also.
It starts with having that appreciation that I am as good as my workforce. My company is as good as the resource. You know, you've heard of the saying, garbage in, garbage out. If your workforce has garbage, and I'm talking about their capabilities, their mental status, their well-being, indeed, then that's what will translate in terms of output. So, number one, companies must have this awareness. Management, boards must have this awareness that the workforce is a resource, and so we must invest in that resource. 2 is to walk the talk. Having that realization, it must translate into actions. And these are measurable actions, verifiable actions that can even be reported on. For example, if we are talking about overtime, so it is it shouldn't stop at just having a policy on overtime, but that must be executed. So the effort must translate into action. And then lastly, there should be mechanisms for continuous improvement, mechanism of learning lessons, receiving feedback. The employers must provide that avenue where feedback comes in, and they must not retaliate over that feedback, because feedback helps in continuous improvement. Thank you, Chair.
Thank you very much. I had earlier introduced myself. I'm Joanna Manyere. My question is opened. Most of the panelists have talked about the employee and employee, but I believe that mental health actually starts from within the mindset. So what are those approaches that you're giving this employee to take? Because they have to be able to carry the brand of a company. There are many people out there who need that job. So what happens? Should it be a simple sale through? It shouldn't be. So if they are negotiating and advocating for others, what are those practices that you're giving them to have in place? Thank you.
Most of your workplaces don't even have therapy on medical insurance. Some even don't have medical insurance. So really, who are you working for? And why are you doing that to yourself? And why can't you rally yourselves to do it if your HR has failed to do it for you?
Everybody that was employed in the workplace, let's first understand that they were first human beings before they became employees.
Start a union. I once consulted for a company where they fired some of their employees in Kenya who are trying to get unionized. Guess what? They sued them, and they're still suing them. You can't do it. People learn from Kenya. Sue your bosses. Make money.
The Honorable Minister is walking in. A moment. Let's all stand.
Thank you for this opportunity. My name is Gloria Ivera. I'm the women chairperson for TOHASA, Tanzania, and I also work as a private consultant. And this now goes to Mr. Ogwal as a policymaker. And this is about having welfare committees in the workplace. We've already come so far about OHS, and now we have safety committees in workplaces, and that is very well described, I believe, in the harmonization of the regulations in East Africa. In every country, you are supposed to have a safety committee. Now, we don't have welfare committees, and one of the emerging issues that are causing mental health issues in the workplace is sexual harassment. And sexual harassment is not only for men, for women, it is also for men. Younger men are being pursued by us old women. And so we need to have a mechanism in the place to make sure that we protect the mental health of these people. It is not very easy to work where you don't have anywhere to go and take your problems when you are mentally not okay. So this is for especially policymakers to ensure that as much as we've put in workplaces safety committees, we need to have welfare committees. And I've seen it in several companies working very well, where there's an established committee where things are being reported, and then a good approach is being taken to sort it. Thank you for all the presentations.
Emphasizing again, it's okay not to be okay. We all have good days, bad days, as our peers do.
You've not just hired what they can do, you've hired also what they cannot do.
But you know, we recruit, but we have to make preparation before these people are dispatched to go to these countries where they are going to work to.
We all know culture is a perception, so whatever I'm going to say is what I perceive. It's not the right answer.
In Uganda, what avenues are there to regulate the quality and also the curriculum of the trainings?
Every injury or illness prevented and every life saved is significant towards national development and harmony.
As companies, we actually have to be able to adapt the culture of living, delegating different workforce, because you find one person actually has one task and someone else has like 20 tasks.
I want to thank you all for your attention, and I wish you a productive conference for God and my country.
Thank you so much.